we're going to talk about onychomycosis, which is a fungal infection to the toenails or nails. It occurs most commonly in adolescents and adults. If it occurs in a pre-adolescent or child, it is normally from being exposed to family members with a recurrent tetanus pedis or athlete's foot. In adults, the infection is associated with advancing age, smoking, peripheral vascular disease, diabetes, and immunocompromised states. Some of the main things that you want to look at is you want to know the onset, duration, and distribution and appearance of the lesions and the presence of symptoms. Different colors, different textures of the nail, where it enters the nails, the nail raised from the nail bed, can help to distinguish between the different types of onychomycosis, which those different types are proximal subungual onychomycosis, which enters from the posterior nail. It's most commonly in immunocompromised patients. Distal and lateral subungual onychomycosis, which is usually yellow and white in color. Infection to the nail surface only, the superficial white onychomycosis is white, patchy. The nails crumble, they're rough. It is an infection to the nail surface only. And then with total dystrophic onychomycosis, which is seen most commonly in AIDS patients, is a chronic yeast infection. You also want to know if it's painful, because normally with onychomycosis it is not painful, and you just want to make sure that you don't misdiagnose or miss something else that your patient may be experiencing. Normally you want to know if they've tried any over-the-counter remedies, because normally they do not help. Does not get better even with whatever they try at home, which sends them to the healthcare provider. And make sure you examine the skin, the type and duration of the lesions. Distinguish based on appearance between the different types: yellow, white, patchy, separating from the nail bed, enter posterior to the nail, toenails only, is it on the fingernails? You'll want to do a fungal culture. It'll take you 3 days to get the results, but to ensure that you don't need to make any changes to the medication that you place your patient on. You also want to do a KOH exam, which is necessary for diagnosis because only 50% of dystrophic nails are due to dermatophytosis. Helps determine the fungal infection and what you see. Do you see the spores? Are they spaghetti and meatballs in appearance? Distinguishing between the different types so that you place your patient on the correct medication. Topical treatment is generally not very effective, 10% or less, but worth a try due to decreased side effects. But your patient has got to be religious with applying it, because, for example, with Penlac and Naftin, it has to be religiously placed twice a day for 6 to 18 months for the patient to even start seeing results and to treat or cure the infection. Systemic therapy is what authorities recommend. Some examples are Sporanox. They take it either daily for 12 weeks, or they can take it daily for 1 week with 3 weeks off, and then twice daily for a week. They're long-term treatments. With Lamisil, it's 12 weeks, 6 to 12 weeks that you're on it. With the Globulin V, you're on it for 6 months. With these, for the follow-up, you need to see your patient in 4 weeks. You've got to get baseline liver function tests, renal function and whatnot, because these medications can worsen those conditions, and you want to check them every 4 weeks to ensure that you're not doing your patient more harm than good. If you have resistant cases, they need to be referred to the dermatologist. Make sure that you instruct your patient to avoid tight and ill-fitting shoes. Cotton socks, change when they get moist as often as possible. Air dry feet as often as possible. Wear open-toe shoes or slippers as often as possible. And nail regrowth may not be seen for 3 to 12 months, and to follow up if their treatment does not help. That way we can get them to a dermatologist that has more specialized education and knowledge in this area, whereas we are just trying to treat what we think is going on. Thank you.